Good afternoon, everybody. I'm Nathan Savory, and I'll be talking to you today about Surgery Connect and the differences that it'll have on primary care and what we've done so far. So I'm just going to do an introduction of who I am and how we can help you in terms of a telephone system. So in terms of the actual telephone system itself, we've been partnered up with a company called Exxon, who have an experience of 18 years with the telecommunications sector. Now, with EMIS's experience within primary care, obviously coming together, we know the actual primary care, we know the healthcare sector, and we're here to support you guys. Just to give you an idea of who I am and what I'm responsible for. So I'm Nathan Savory, I'm the technical architect within EMIS Health. I work alongside Jonathan Hardy and James Pashley, and we also have other technical architects within specific regions. Some of us, you may have spoken to us in terms of different solutions, but the solution I'm going to talk about today is Surgery Connect. Now, the reason why I want to talk to you about Surgery Connect is at the moment in the pandemic situation, we've needed to support the practices, the CCGs and the federations. We're also speaking to a lot of PCNs as well in terms of how we can support you guys. So I'm going to go over some of the actual features and benefits of the solution today. But just to let you know, the actual session is recorded as well. And it will be shared after the actual event. If you've got any questions whatsoever, please go by the Q&A button, and any questions will be answered in the session as well. So feel free to ask any questions. James and Jonathan Hardy will be there to support you in those questions as well. And even if you guys have got any questions after the session, feel free to email me. So just to go through the actual solution itself. So what is Surgery Connect? So I'll explain what Surgery Connect is and what it means to the healthcare market. So Surgery Connect is a complete cloud-based telephone system. So it's a fully managed service. And it's a one-stop shop for everything. So you don't have to have different suppliers to get a solution that you require. If you've got an issue with the telephone system or you need to make any configuration changes, you contact us. It's a one-stop shop. We're one UK-based team as well, so your support is based in the UK. And you also have the up-to-date call centre technology as well. Normally, with contact centre technology, there's an extra charge for this. The positive thing about Surgery Connect is we include everything in one. So any features or benefits from a contact centre environment will include. The minutes are included, the support's included, the hardware is included. So there's no outlay capital cost for you guys to pay. It's the same cost that you guys will pay monthly, if not cheaper. Any future updates and features will roll out at no extra charge. So we ensure any features that you guys may want, we can push to our development team. If we've got enough hands in the air shouting for certain features, the development team will push that forward and you guys will benefit from that. Any hardware warranty in the place of the duration of the contract. So we do a minimum of a 5-year contract, we'll support you. So if any handsets go faulty or if there's any issues with any hardware at all, we'll fix that for you, or we'll send a new bit of equipment out. So it means headsets, handsets, switches, anything that we can do to support you guys, so there's no additional cost. And the good thing about it, you guys know what you're paying. So we basically charge £25 per user, so per handset, per month. No additional charges on top. As I said, we've worked with telecommunications previously, but Exxon have I've had 18 years experience with the telecommunications sector. So us joining together was a no-brainer. We want to ensure that we're able to support PCNs, federations, CCGs and practices as well. We understand everybody works differently, and the good thing about this telephone system is that we're able to cater for your requirements. So it's EMIS Web fully integrated. Now, those that aren't aware, it's also System 1 integrated as well. So if you've got a specific CCG, for example, and it's got a mixed estate, it's not an issue. We can cater for both clinical systems. It's not a problem at all. I'll also send out some further information on that, where you can actually read more information about it. So we'll include it in the link as well. We're able to enable practices to vastly improve the patient experience. So if you look at the actual patient experience from when a patient calls in, say for example on a Monday morning, and they're unable to get through, we offer a queue busting system, which means that they'll be able to get a call back. We'll also try calling the actual patient back 3 times as well, to ensure that we can try and get hold of them. Now, there's no additional cost for this feature. We just provided part of the solution. So I just want to go over the actual highlights of the actual system itself. My apologies. So what this means is no more engaged tones for patients. So if they need to get through to you, they won't hear an engaged tone. Traditionally, you'd get an engaged tone or they wouldn't be able to get through. Now, this is because you'll be paying for 1 line or 2 lines for essential. So 1 line going out, 1 incoming call. It means you wouldn't be able to have a 3rd incoming or outbound call, which then gives the actual patient an engaged tone. Now, many of you know this causes a lot of complaints and it's not really good for patient experience. We're able to provide unlimited outbound calls and make any calls available. So whether it be an inbound or outbound, this is to ensure that the availability is there and the patient experience is adhered to. We're able to free up a receptionist time as well. So on an average afternoon or week saved, the time that they're not on the phone to patients, they're able to utilise that time elsewhere. As you can see here, it also improves DNAs. It also pays for your actual phone system as well, because you're not using any additional costs for a service that you require. Everything's included. We're able to reduce the time spent on complaint management as well, and also keep the actual calls recorded, so you're able to refer back to those calls for training sessions or any relevant sessions that you guys want to use them for in the future. If it's the case that you guys need to go back and listen to a call 2 years down the line, it gives you the option to be able to do that. We'll hold the call recordings for 36 months on retention, and then you guys have got an option if you guys want to keep them on a server within the practice or a secure device, for example. All the actual call stats and staffing levels you guys have access to. So we'll provide you a portal where you guys can view that information. So at any given time, if you guys need to run a report and include it in your weekly sessions, we give you the opportunity to be able to do that. So you'll be able to see how many calls are coming in, how many calls are going out, how many staff are on calls, and how many is on admin, for example. And just to give you an idea, the system gives you peace of mind because it's reliable, robust, and we also look at business consumer as well. So where the mobile working comes in. So we'll provide you with a mobile phone with the reception handsets to ensure that you don't have any downtime and the patients don't realise there's no downtime. So if you look at the pandemic situation at the moment where patients haven't been able to go into the practice, because we switch the actual service over to a mobile phone, they don't know any different. You can have a receptionist working from home, whether using a headset on a laptop or using a mobile phone, which we provide free of charge as well. So if you actually look at some of the actual call features here, I'm not going to go through them all, but if you look at some of the ones that are highlighted here, such as number porting, we're able to port all your existing numbers because those are the numbers that will be on your website. Those are the numbers that your patients recognise. So we can keep those numbers and we'll port them over for you. You get unlimited capacity, so patients will never ever receive a busy tone again. And because of the queue busting, we'll call them back. There's no cost to the patient for this. It's all part of the service. It's all included in the minutes as well. Automated timers. So you're able to control the time of day of patient access, bank holidays, training day settings, and departmental accessibility. So if you've got any training days or bank holidays, for example, instead of manually doing it, we can input it part of the calendar and it's there, automatic. Menu options. So we'll provide you with departmental choices given to the caller who are routed based on their selection. So if you want the actual calls to be routed to a specific department, we can include that on the actual telephone system, which I'll show you. I'll make this slide deck available to you guys as well, so you guys can actually see the full features and the benefits for it from the actual system itself. So I mentioned about the call recording. There's the intelligent distribution groups. We can make it as complicated or as simple as possible. The hold, transfer and short dial feature as well. Just once calls have been answered, they can be placed on hold or transferred to any other extension. If you guys got current extension numbers that you guys already recognise, we can follow the same extension numbers, so it's no different to you guys. It's about making the system easier for you guys when it's deployed. So why would you choose a cloud-based telephony solution? So hardware, I explained, there's less hardware, there's no on-site maintenance needed. Hardware and warranty in place for the actual duration of the actual contract as well. So there's 5 years minimum contract. When we talk about scalability, whether scaling up or down, there's new extensions that can be added. So if you've got new staff and you need additional extensions, we can add that on there as well. When we talk about upgrades and updates, you get that rolled out. So anytime there's an update, you'll be provided it free of charge. Talk about resilience. I spoke about this in June. If you look at the pandemic as an example, and patients not being able to go into the practice, we'll provide you with backup phones, which are supplied with the reception extensions. So it covers any internet outages or users can log into the personal mobile phones or landlines. And we also do a dual site resiliency on all of our platform servers. So there's no downtime from us guys. What I will show you, which is quite important, is the actual workflow. So in terms of the actual price, this is what you get included. So you get the gold level support 24/7 cover, free feature upgrades, the hardware, the unlimited minutes, the call recording. We also provide you on-site training and go live support as well. And you also get a dedicated broadband line coming into the actual site itself. So if you've got a main and you've got a branch site, we'll put a dedicated line to each of those sites. Now what I'll show you, this is the call flow example of what the actual it looks like within the system. So as you can see here, you can see the caller coming into the actual main line. They'll get a welcome message, and then from the actual main menu, they'll have the options of being able to book an appointment, cancel appointments, prescription inquiries, test results, general inquiries, or information menu. And also we can make this as complicated or as simple as possible for you guys. So this is just to give you guys an idea of what it looks like. When we talk about the actual handsets itself, this is what the handsets look like. So as you can see here, this is the actual hardware. So you get a reception handset, you get a headset, you get a mobile phone. We also provide cordless extensions as well as the standard extensions. Now in terms of the service level agreement, this is an idea of what you get. So you can see the service level agreement here, which is pretty good. And we also provide you with a gold standard level agreement. The reason being is because we want to ensure that you get the best experience from the system and you get the best support from us. What I will do now is pass you forward. Any of you guys that are interested in the actual solution itself, we'll put a link in the Q&A section for you guys to have a further conversation with myself or one of my colleagues such as Jonathan Hardy or James Pashley. Any of you guys that are interested in triaging, which seems to be a very big topic at the moment, please register a 6 o'clock session for your interests on the website. We'll also include that in the actual Q&A as well. But thank you guys for your time and feel free to ask any questions that you may need. Thank you.